Hello, everyone. My name is Jose Caballero. I am a senior health education specialist with Solano County. And again, I have Dr. Christine Wu. She is the Deputy Health Officer and Chief of Communicable Diseases for Solano County. And this is our COVID-related updates and tips on how to stay safe as we continue to ease the restrictions for the shelter-at-home order. Hi, Dr. Wu.
Hi, Jose. Thank you so much for having me back. We're going to pull up the dashboard now. And so as you can see, on May 7th, 2020, there has been a total of 342 cases of COVID-19, including 7 deaths. Of the 72 that are actively ill, 11 are currently hospitalized, meaning that the majority of our cases are asymptomatic or mildly symptomatic and do not require hospitalization. Our hospital capacity for ICU beds as well as ventilators remain good. And if you are to explore the dashboard yourself, you'll see that the majority of these cases are in Vallejo. I want to again reassure everyone that it is likely that the increase in cases that you see is due to a combination of increased testing that we're doing in Vallejo, as well as an outbreak that we're currently managing in that city. We are tracking the number of hospitalizations as well as the percent positives against the number that we test. And I had mentioned this last week as well. And both of these numbers and metrics have not shown a concern for community spread. What is concerning, however, is that we do see a racial discrepancy in those who have had the worst outcomes from COVID-19. Like what has been seen across the United States and in California, those who have died in Solano County were ethnic minorities, including African Americans, Latino, and Asian and Pacific Islanders. Now, this may be because these are the same ethnicities that even before the epidemic have had less access to healthcare, and likely had chronic health conditions that were not well controlled, which made them more susceptible to the worst outcomes from the novel coronavirus.
And Dr. Wu, what is Solano County doing to give more access to testing for people?
Especially for people who, so these people that we had talked about who have the ethnic minorities, and anyone who doesn't have access to healthcare can get tested for if they're concerned about coronavirus, regardless of whether or not they have symptoms, through one of our new community testing sites that is available in both Vallejo and Vacaville. And as you saw from the dashboard, we've done completed nearly 5,300 new tests now, and we're continuing to ramp up these testings through these community testing sites that's sponsored by the state.
Okay, and 2 questions with regards to testing. Some people have asked me if this is free or do they have to pay?
So, as I said, we're ramping up testing, and this is all free. It's, so that's how come, those people who have less access to healthcare can really benefit from this. And we're also allowing people who don't live in the county, regardless of symptoms, to come and use our sites. And the only way that they can get testing through these sites is by appointment only. I do want to mention that, okay. And that's really important that people access, schedule an appointment in order to get tested through this site.
Okay. And that was my second question is, can I just show up without an appointment and get tested? But you're saying I have to have an appointment before I show up, correct?
Yeah, so I do want to say that, unlike what we have offered previously, which were drive-through testing, this is a walk-through test, meaning that you have to get there, get out of your car, and go in. The testing is available at these sites Monday through Friday, 7 a.m. to 7 p.m. currently. We have addresses on our website, but I'll just tell you, the one in Vacaville is behind the Fentons, and the one in Vallejo is at the North Vallejo Community Center. The testing, as I mentioned, is by appointment only through a scheduling system online. But if you don't have internet access, there is a number to call, and I will say it right now, but we'll also list it as part of this video. It's 1-888-634-1123. Anyone, regardless of insurance or symptoms, can make an appointment to be tested.
Okay, perfect. And the other question that we've gotten recently is with regards to antibody testing. So if people without symptoms get tested, will the test tell us if they've had infection in the past, or if they're now immune to COVID-19?
So the test that this community testing center is offering is a PCR based test, which is what we have been using in the public health lab, and what tells us whether or not a person currently or at the time that they give a specimen, whether or not they have COVID-19 infection in their body, regardless of whether or not they have symptoms. So, because sometimes people have no symptoms and can have the infection as well. Eventually, we will start to offer the blood test, which will tell us whether or not there are antibodies in someone's blood. And however, we're not using that. And I mean, that's really good to have that information, because that'll tell us how many people in our population has been exposed to coronavirus, the novel coronavirus. But, it doesn't tell us whether or not that person currently has an active infection, and doesn't tell us whether or not that person can transmit the virus to somebody else. So, and actually scientists don't yet know whether or not, what the antibody in the blood test really mean. Does it mean that the person who has antibodies is now immune,
Okay.
or if they are immune to getting reinfected, does that mean, how long lasting is that going to be? So we don't know that information just yet. And that's why, as we open up, it's especially important to be able to ramp up the PCR testing, uh, and make sure that anyone who potentially could be having an active infection is able to know their COVID-19 status.
Great. So for now, we have testing for everyone inside and outside of our county, and that's free of cost. And that doesn't include antibody testing, mainly because we just don't know enough about it. Yeah. And you brought up a good point, which I wanted to talk about next, which was transitioning a little bit into the economy. People have still been asking us, how is public health going to ease the restrictions to open up our businesses and our society up again?
Yeah, so in this spirit, I've been saying this for the past several weeks now. I think, in the spirit of what the governor's office has put out as a guidance for all the counties in California to do to have this to gradually reopen. Solano County is also developing and has also developed a roadmap to reopening that is based on the risk of transmission. And some of you may have gone to the Board of Supervisors meeting online to see those meetings. And if you haven't, they are recorded, and you would be able to go back and review them once they're posted. Dr. Matias, Bela Matias, our health officer, this past Tuesday, May 5th, did a very great explanation of what that roadmap looks like. So, and how we would reopen. So I encourage everyone to go and on that website to look at that themselves. However, I do want to say that we did already last week start opening up some of our health orders, easing our restrictions by allowing many outdoor activities like golf. That was new, which are things that the governor approved at the same day, I believe, because we think that those really have minimal risk and to cause the community transmissions, and can be done in a safe manner. Going forward, low risk businesses potentially be able to, or organizations and activities could potentially reopen very easily if they create a social distancing protocol to describe how they could function in a safe manner, and to take steps that can decrease the risk of COVID-19 to their patrons. As you may have seen, many of our grocery stores have been operating this whole time as essential services with the social distancing practices in place. Going forward, there could be the medium risk businesses are ones that can't do the social distancing. And so we're going to have to look at the guidances that the state and potentially will provide to help these businesses be able to open safely. The main thing, and then high risk businesses, of course, will have to, it'll be something that will depend on how, how well we're doing overall with opening and how, whether or not there is community transmission by the time we open up these low and medium risk businesses. However, I do want to say the most important thing is as we open up, that we keep in mind that this does not mean that we need to forego the 6-foot distancing recommendations, and the good hand hygiene or cough etiquette that we've been telling everyone to continue to do. And I just want to reiterate how important it is for all of you to continue to follow the guidance that public health provides as we gradually reopen, because that is what is so important to protect our vulnerable populations and not see the second spike or the spike in new cases from community transmissions.
Okay. Awesome.
Sorry, I'm
Thank
just
you for
fun talking.
No, thank you for that explanation. I think it's really important to highlight what you just said, which is we're really going to be doing this based on risk level. And it really is to protect our community. It really is to protect our vulnerable population. And it's to make sure that ultimately, as a county, as a country, we are in a better place. And I also wanted to ask you, I know that this weekend is Mother's Day. So happy early Mother's Day to you. I know that you're a mother.
Thank you.
And does this mean that I could take my mom out to brunch this weekend?
So, actually, the answer to that, unfortunately, is still no. Okay. There are, it's still unsafe. I don't know how, your mother is, there are certain populations where it's still unsafe for them to be out and about. And those are, the people who are older, the elderly population of our county, as well as people who have underlying chronic health conditions like we've been talking about this whole time. They should still try to remain at home as much as possible, and limit their contact with strangers, especially in any place that could be have people that they don't normally live with. But large gatherings, even when we reopen, large gatherings are still not safe, and will not be allowed for some time. I do want to urge people to not jump right into hosting, or attending social gatherings, even as we start to relax the health orders, the stay-at-home orders, just because if you do that too quickly, that could cause that spike that we're so concerned about. But I do want to say, all of our restaurants are open for takeout. And so, one thing you could do for your mom is you could, call one of the restaurants that are open and ask to order to go pick it up and bring it to your mom. I bet she would love it.
Okay. So the best way to protect my mom for Mother's Day is to keep her inside, and we can do our own celebration in a much lower risk environment.
Exactly.
Thank you for that.
Exactly.
Thank you so much, Dr. Wu, for being with us again here today. As always, I want to make sure that people know that we are going to continue keeping you informed, whether that be if you follow us on our social media page at Solano PH, or if you follow us on our website at solanocounty.com/COVID-19. We also have a warm line and an email address that we will have linked to this video, and we would love to hear your comments, and please share this video with someone who you think might benefit from this information. Thank you so much, Dr. Wu. See you next week.
Thank you, Jose.